Diagnosis of the gonococcus. The gonococcus is usually distinguished from staphylococci and other gram-positive cocci by the gram stain. Errors in diagnosis by the gram stain, apart from those due to ignorance and carelessness, have three sources, viz. 1. There are other gram-negative cocci from which the gonococcus can only be distinguished by culture. Such are the Micrococcus catarrhalis, the Diplococcus intracellularis, and certain chromogenic cocci. Happily, none of these organisms except the Micrococcus catarrhalis have been identified in the genitourinary tract. None of them, except the M. catarrhalis, is believed to cause urethritis. The urethritis caused by M. catarrhalis is probably insignificant and not to be clinically mistaken for acute gonorrhea. I have encountered it but once in several hundred cases. 2. Apart from M. catarrhalis, it must be emphasized that in a small percentage of cases, the normal urethra, and in a somewhat larger percentage, the normal vagina, contains gram-negative cocci, which can usually be differentiated from the gonococcus by their form, size, and extracellular position. These organisms fail to grow on the ordinary culture media. 3. The most frequent source of error is the fact that the common staphylococci may be gram-negative as well as gram-positive. As Crabtree has suggested, this variability is doubtless due to the presence or absence of albumin. But these confusing factors that render the diagnosis by gram alone quite valueless apply almost exclusively to chronic urethritis. For clinical laboratory diagnosis of acute genital gonorrhea, it is only necessary to identify a gram-negative intracellular diplococcus. The gonococcus in the conjunctiva and in joint exudates is equally unmistakable. Rectal, buccal, and nasal gonorrhea require diagnosis by culture. The cultural characteristics of the gonococcus have been described. An important feature in the diagnosis is that the gonococcus ferments glucose, and perhaps maltose, but not other sugars. The Micrococcus catarrhalis grows more readily than the gonococcus on the usual media. On serum agar, it makes two kinds of colonies. The one, thick and crumbling like mortar, does not resemble the gonococcus. The other is quite similar to the gonococcus, except that the colony is smaller. But the distinguishing feature of the Micrococcus catarrhalis is its inability to ferment glucose. The other members of this group grow more readily on the familiar media. Thus, the Diplococcus intracellularis grows on nutrient or glycerin agar and on Loeffler's blood serum agar. Concerning serum reactions, Elser and Huntoon state that when properly controlled, agglutination tests serve to differentiate the various groups from each other, providing the strains tested are sufficiently agglutinable. Diagnostic difficulties may arise in connection with certain gonococcus strains. These are unusually sensitive to the action of normal and of group agglutinins and may yield higher values in the presence of a meningococcus immune serum than moderately agglutinable meningococcus strains. Absorption tests served to differentiate the various groups of gram-negative cocci from each other and to establish the identity of the agglutinable and inagglutinable meningococcus strains.